Hey guys, my name is Sophia Kagan, and today I'll be talking to you guys about yellow fever. So yellow fever is a viral infection that's caused by yellow fever virus. It's found in the tropical and subtropical areas of South America and Africa. And it's transmitted by the bite of an infected mosquito and can cause jaundice in severe cases, which is a yellowing of the skin and the whites of the eyes. And this is the main hallmark of the disease, and that's what gives it its name of yellow fever. The disease is one of several hemorrhagic fevers that is caused by viruses in the genus Flavivirus, which is part of the Flaviviridae family. Other viruses in this genus include dengue fever virus, Zika virus, West Nile virus, as well as the viruses that cause St. Louis encephalitis and Japanese encephalitis. And here at the bottom of the screen we have a photo of the yellow fever virus, an electron micrograph. So most infected persons are asymptomatic or only have mild illness. The incubation period is typically 3 to 6 days after the mosquito bite that causes the infection. And the disease initially presents itself with flu-like symptoms such as fever, chills, severe headache, sometimes nausea and vomiting as well. Approximately 15% of infected persons do develop a more severe case of the illness, and this can be life-threatening. So these symptoms include a high fever, jaundice, abdominal pain, vomiting, internal and external bleeding, as well as multiple organ failure, and eventually also a slowed heart rate, as well as decreased brain activity, which can lead to a coma and eventual death. So approximately 20 to 50% of these more severe cases are fatal. It's difficult to estimate because yellow fever is very difficult to diagnose. A lot of the symptoms are very similar to other fever-like illnesses such as dengue fever or Ebola and West Nile virus. So these photos show some of the signs and symptoms of the disease. On the top left, we have an image of a man who has jaundice, as you can see by the yellowing of the whites of his eyes. And on the bottom, we have a photo that kind of shows the difference between the skin tone of someone who has jaundice as opposed to a normal skin tone. And on the right, we have more general signs and symptoms of yellow fever. So the headache, the red eyes, the fever. The external bleeding occurs primarily through the eyes, nose, and mouth, as shown here. The hepatomegaly is also a symptom of the disease, which is an enlargement of the liver, and ultimately that's what causes the jaundice that is typical of yellow fever patients. So the virus itself is a positive single-stranded RNA virus that has an envelope. It is transmitted through vector transmission through mosquitoes of the Aedes aegypti species in Africa and the Haemagogus species in South America. There are 3 different transmission cycles for the virus as reported by the CDC, and those are shown here. So this shows how the virus is transmitted from mosquito to a human, and then that human then can become infectious to another mosquito. If that mosquito bites an infected person, it can also become infectious to other humans or non-human primates as well. There's been no documented evidence of direct human-to-human transmission of the virus, which is part of the reason why it's so contained in the areas where these mosquitoes exist. But overall, this chart shows how a person, for example, traveling to the jungle can be infected in the jungle, and if they travel back to an urban area and a mosquito there bites them, then the disease can be transmitted and perpetuated in different environments. So populations at risk are primarily people who live in or travel to the areas where the mosquitoes are infected. So again, these are the areas in Central and South America as well as parts of Africa. Infected persons, however, generally have a subsequent lasting immunity to the disease after they are infected. So typically people who recover from the initial form of the disease are immune to it for the rest of their lives. Older adults are at greater risk of becoming more severely ill with the more severe symptoms, and this is simply due to their weaker immune systems. And the World Health Organization has estimated approximately 200,000 cases of yellow fever that occur per year in the world, and about 30,000 of these are fatal. There is some research that suggests that the South American genotypes of the virus may be more virulent than the African genotypes. However, this is slightly disputed due to the fact that yellow fever is so hard to diagnose, and just different statistics and everything are kind of disputed. So here on the left, we have an image of an Aedes aegypti mosquito, and they're the species that transmit the virus in Africa primarily. And on the right, we have Haemogagus species mosquito. Those are the ones responsible for transmitting the disease in South America. So here we have some maps that show where the disease is most prevalent. This is from the CDC, and it's based on vaccine recommendations. So the yellow areas show areas where a vaccine is recommended for people traveling there. The dark green areas, generally a vaccine is not recommended for these locations. However, depending on the time and if there's any current epidemics going on, a vaccine may be recommended. And the light green areas, generally a vaccine is not recommended because yellow fever is not really a threat at all. So yellow fever is a very preventable disease with a vaccine. The vaccine has been available since about the 1940s and does not require a booster. It's very effective, and neutralizing antibodies seem to have been produced in 99% of vaccines within 30 days of reception of the vaccine. It's a very, very useful, very effective vaccine. It's recommended for use for travelers who are going to affected areas, and some countries even require the vaccine for entry. It's a very rare cause of illness for American travelers who generally do get the vaccine if they are going to these areas. As far as prevention is concerned, besides the vaccine, the use of mosquito repellent is encouraged, as well as any possible measures that can be taken to avoid mosquitoes in areas where epidemics can occur. There is no cure for yellow fever itself, so the treatment is based on symptom control. So patients will typically be hospitalized and given pain-relieving and fever-reducing medication to help kind of reduce the symptoms. Doctors generally avoid non-steroidal anti-inflammatory drugs because they can increase the risk of hemorrhaging and internal bleeding. So typically they won't prescribe ibuprofen or naproxen or other anti-inflammatory drugs like those. Patients are usually kept in the hospital for at least 5 days after the onset of the fever. This is to avoid further exposure to mosquitoes after they've been infected. And it's not so much to protect the patient as it is to prevent further transmission of the virus, because again, if a mosquito bites the person, then the mosquito will become infected and infectious to other people. Here's some brief historical facts. So yellow fever was a very feared disease in the 17th and 18th centuries because it was very misunderstood, and it was fairly common. There was a large outbreak in 1793 in Philadelphia, which resulted in 5,000 deaths out of the 45,000 population of the city of Philadelphia, which is one of the most severe epidemics that ever occurred in U.S. history. In 1937, Max Theiler won the Nobel Prize. He won the prize in 1951, but in 1937, he developed an effective vaccine against yellow fever virus, and he was awarded the Nobel Prize in Physiology or Medicine in 1951. And this was the only Nobel Prize that has been awarded for a virus vaccine, which was interesting. And the last known outbreak that occurred in the U.S. was in 1905 in Louisiana, so it really has not been an issue in the United States for approximately 100 years. And the most recent outbreaks have occurred in the Democratic Republic of the Congo and in Angola, and these were reported just this year in June to the World Health Organization. So even though it's not so much of an issue in the United States, the disease is still very relevant and very common in other parts of the world. And here we have an image of Max Theiler receiving his Nobel Prize in 1951 for the vaccine. This chart on the left shows the recent outbreaks from 1985 to 2009 of yellow fever in Africa and South America. This is the number of cases reported to the World Health Organization. As you can see, there were many more reported from Africa than in South America. But again, documenting these cases can be very difficult, and the estimates are very rough sometimes because of the difficulty of the diagnosis. And on the right, we have a photo of an Angolan military member who is administering a vaccine against yellow fever to a child This was following the recent outbreak that occurred in Angola in June of this year. So that's the end of my presentation. I hope you enjoyed it, and I'll see you all on Friday.